We have here an environment which is inherently toxic. It has these characteristics in it which over time reliably cause harm to people's mental health. You know, we've got very clear evidence that that's the case.
Dr. Peter Young has been Director of Mental Health Services for the entire immigration detention system for the last 3 years. He says the system is designed to make people suffer, that it's inevitable.
About a third of people in the system would have a level of mental health problem that we would call a significant level of disorder. And most people have a level of resilience which allows them to function fairly well for a few months. But after that time there's just a steady deterioration. Anybody who's been in detention for any length of time, greater than a few months, will have symptoms of anxiety and reactive depression almost universally. The longer people stay in detention, the higher the risk that those symptoms will develop into something which is a recognisable psychiatric diagnosis. There have been a number of cases in which there have been quite significant delays of getting them into treatment because of resistance from departmental officials.
Delays that endanger their health?
Yes, definitely. The level of acceptance that the environment is the factor that has led to the condition or is preventing the effectiveness of treatment is often strongly opposed. And we've been told at times that it is unacceptable to state that.
To actually say, the problem here is the detention centre, the problem here is indeterminate detention, that's causing the mental problems, but you're encouraged not to say that.
Yeah, we're directed not to say that. They are being treated, but that treatment is of limited effectiveness because the conditions in the centres are perpetuating the disorders.
Because the problem is the system.
Because the problem is the system. It's not the same as being in prison. People are more well when they're released from prison than when they entered. What we see in detention is the opposite of that. Over the course of time in detention, they get sicker in their mental health. It's quite clear that people are going to experience mental health problems while they're there, and that those are going to accumulate and get more serious over time. The only mitigation we have against that is the teams on the ground, and there's nothing in terms of any higher levels of care that's available.
And how effective is that mitigation?
It's very limited in its effectiveness. We cannot mitigate against the long-term effects of detention. It's not possible.
To Manus Island, Australia has sent over 1,000 asylum seekers to be held there indefinitely.
When you go to Manus Island and you walk down what is called the walk of shame between the compounds, and you see the men there at the fences, it's an awful experience.
Did you feel shame?
Absolutely, yes. You always feel that, and if you don't feel shame, I mean, you have to feel shame. You have to experience that. You have to understand what that feeling's about.
Is that why you're talking now?
Yes. The primary duty of a doctor is to do no harm. If we see harm being done, the duty is to speak out against that harm, to say that harm should not be done. If we take the definition of torture to be the deliberate harming of people in order to coerce them into a desired outcome, I think it does fulfil that definition.
So we're torturing?
I think so. I think that it's not a huge stretch to say that.